like full introduction as much as I'd like to get to know everybody. But I do want to do a little exercise before we get into sort of the meat of the presentation. And it won't be full 60 minutes. I'll try to keep it to sort of 20, 25, and then we can have time for questions as you wish. But I want you to think about in your head, it's good to share these things with our neighbors, and also for me because I don't live in this neighborhood. What is something wonderful about your neighborhood? What is something that is really special that, say, family comes from out of town? Where do you want to go with them? What do you want to see with them? What do you want to experience? Sort of very locally though, not broadly in San Jose or the county, but in your neighborhood. And if you think of something that you'd like to share, if you can raise a hand. We'll start right here.
Diversity.
Diversity. Can you say like one sentence about what you mean?
Diversity of food. We have group activities in our neighborhood, and people bring their, whatever food they're familiar with.
Yeah.
And getting to experience all those different foods.
Awesome. The diversity of food and also the people coming together to share food. That also sounds like a wonderful thing. Someone else? Yes.
We have a lovely community garden down the street.
Ah, very nice. And how do you experience the community garden?
I have a plot there, but it's just a nice place to take people to visit. It's a lovely green space.
Yeah.
Where is it?
Awesome. That does sound wonderful.
Moreland Community Garden.
Now see, I like this. People are excited to share. Yes.
We are in the same community, and the other things that we do are, since 1998, we've had a book club.
Yeah.
Meets once a month, and we have an annual July 4th party where all of us can come, annual Christmas party. We send out a notice with all the people's names and phone numbers of everybody living around us. So it's a really nice group of people.
Yeah, that sounds great. Anybody else? Yes, thank you.
We're close to some, I consider them some pretty cool restaurants. Mizu, Japanese if you like the Japanese fusion. Maggiano's if you like the Italian.
Yeah. Awesome. Bob?
Two things, Saratoga Creek Park, the awesome park, Long Linear Park, Redwoods all the way along, and then Santana Row. I think Santana Row is a great place to go.
Certainly sound like wonderful things. Anybody else? Maybe one more? Although we could just do this for 45 minutes. That would be fun, right? That would be pretty good. David?
So actually, Robert, I live in the district as well. And one of the things that I'm the most proud of is actually a small little pocket park in our district. It's kind of a well-kept secret of mine, but I usually like to take and have lunches there because it's really nice and quiet, nice area. It's actually Golo Park, and it's been recently renovated, and if you're wanting a nice quiet spot to get away, it's a really nice pocket park to visit.
One thing that my neighborhood is trying to recreate is my partner really wants to do like a big potluck, sort of like what was described over here, and we have a very large dog that barks at other dogs very loudly when they walk by too close to his street, I guess. But to have a sort of different kind of interaction with our neighbors and have lots of people over. We had one more here.
Well, I was just going to say, when somebody moves into our neighborhood, one of the neighbors goes and welcomes them and tries to like to see that.
Awesome. Yeah, and I experienced when I moved into the neighborhood where I live now, we did something similar. We sort of offered a welcome gift in reverse to our nearest neighbors to say, hey, we're here, here's some cookies and orange or whatever. And about half the folks were just shocked. You know, they hadn't spoken to anybody else who had sort of moved in, and we're renters, right, recently into the neighborhood. So what I'm hearing is we love places that bring us together, right, that we can sort of experience together. We love open spaces that we can enjoy. So parks, nature, Santana Row, different kind of open public space. And what we all want for our neighborhoods are to increase those experiences and opportunities for all of us, right? We heard diversity, and diversity can be like types of food, but it can also be income levels and different parts of the country that people come from. And so I think these are values that I hear about across the county, right? These are not sort of like specific things. There were specific places, but these are not specific things to the neighborhoods here. And what we want to work on in terms of our work to end and prevent homelessness is to improve those experiences, yes, for those who are suffering the experience of homelessness, but also for all of us. And that we believe that really if we work together, we can move toward those things more effectively. I work for Destination Home. My name is Bob. Who here has a good idea about what Destination Home is? A couple of you have heard me speak before. Hopefully it's a little bit different. I apologize for that. So not very many, and it's not a test, and this is not a presentation about Destination Home, but just very briefly, Destination Home, I'll start first about what it is not. It is not a direct service provider that provides assistance to people experiencing homelessness. It is not a supportive housing or affordable housing developer. It is not a government agency. What Destination Home is a convener, facilitator, and program piloter. And so we are part of a group of stakeholders throughout the county that involves cities, housing departments, the County Office of Supportive Housing, direct service, nonprofit organizations, other advocates. And the purpose of that is to make sure that we all have the same goal and we can hold each other accountable. Because as you know, in politics here, as in politics probably everywhere, the favorite thing for a political leader to do is to point the finger at another political leader. And even better if that political leader is in some other jurisdiction. So if I'm San Jose, I want to blame Cupertino. And if I'm Santa Clara, I want to blame the county. And we want to make sure, at least in terms of homelessness, that we have a check on that to a degree, right? We can't stop it. People are always going to be interested in their reelection and want to put the blame somewhere else. But we have to make sure that the buck stops somewhere and that we have big goals we can move towards. What that means is, for example, we have a pilot homelessness prevention system that we work with all the nonprofits that provide services, fundraise a bunch more money, I think 14 million in the last 2.5 years, to grow that prevention system. We're going to test it over time, working with the University of Notre Dame on that to see what works, what level of vulnerability, what level of services, what time period, so that we could hopefully put together a more sustainable that we wouldn't manage, that would be a part of the ongoing system. Some other work that we work on, for example, is we do some fundraising to try to get money to make sure the housing happens in the first place. So not as the housing developer, but we partner with a nonprofit housing developer to make sure we can grab onto a piece of land, for example, in the beginning. Because unlike market rate developers, nonprofit housing developers don't have buckets of cash to throw around. In fact, many of them often have cash flow problems. And so we want to help with that so we can move forward. There's several other kind of these like pilot employment pathways. We're also trying to work on a program to put together. But my program is called Housing Ready Communities. And Housing Ready Communities came out of this idea. Who remembers the conversations in our community when San Jose first proposed the bridge housing communities, the tiny homes? Does anybody remember reading about that? So those were kind of difficult conversations, right? There were some shouting in rooms. There were really big and crowded rooms. Even before that, a few years in the city of Santa Clara, there was a development that was going to be for folks who'd formerly experienced homelessness. A fairly wealthy philanthropist and developer in our community wanted to pay for that. It was on city-owned land in Santa Clara. But there was a similar, not so healthy conversation at the grassroots level that then scared a council member, and that development didn't happen. Now, housing is moving forward on that site today, but it's not exactly the kind that we know will help us to end homelessness. So, in response to that, the city and the county and the Housing Authority and SV at Home, who sort of advocates for affordable housing much more broadly, came together and said, we need to have an initiative to make sure that this doesn't happen. We know that housing ends homelessness, which we're going to get to, so we need to work on having better conversations in our community and also identifying kind of theory of change, what's stopping us from moving this long-term solution forward more quickly. It's called Housing Ready Communities because about 20 years ago, more recently in some places, we dealt with homelessness from a housing ready perspective. And that meant that Bob, who has experienced homelessness, has a physical health problem or a mental health problem or whatever it is, but Bob needs to fix all of those things before we're going to talk with him about having a home. And then, 25 years ago, first in New York City, they did an experiment, basically, a test. And they took a group of 200 or 400 individuals and treated them the same housing ready way. And they took a group of the same size and decided to use what they were calling then a housing first approach. And that said, instead of Bob having to fix all of his problems first, we're going to place Bob into a home, provide the services that he needs based on his individual challenges, and then we're going to look in a year and 2 years about who has successfully ended their homelessness as a result of these different approaches. And you can probably imagine the housing first approach was overwhelmingly more successful. And we're going to get into some of that data as well. I didn't finish the story, right? This is called the Housing Ready Communities Initiative because the takeaway is it's not Bob who has experienced homelessness who needs to be housing ready. It's all of us who already have homes. We need to be ready for new housing in our community. Housing Ready Communities. That's why it's called that. So I start with this slide almost always just to get it out of the way, right? It looks like a great slogan. We can't end homelessness, housing ends homelessness. But it is not a slogan. It is real. It is the proven way to end homelessness, and frankly also, particularly in our communities, to prevent homelessness. The presentation and our work has three aspects. One is awareness of what we already know, right? We heard some conversation here already about homelessness and how we experience that in our community, how that impacts our lives in perhaps negative ways. But we want to increase that awareness and add some color and detail to that. Understanding are a few of those elements that we don't necessarily know the facts about, right? My background is in community outreach and policy and advocacy, but I only started learning about housing and homelessness a little over 2 years ago. So there were a lot of facts and data that I think I'm a really smart guy, but I didn't know, and I had to learn all of that stuff. So we want to increase our understanding as well. And then the third one is sort of the impetus behind, I believe, the Homelessness Roundtable that the Vice Mayor is working on, and that's what can we do about it? How can I be involved in working on the solution? This is an outline of the presentation, more detailed. And at this point, I am going to hand out my little flyer here. Can you help me circulate these? Because on the back of it is a cheat sheet for the presentation. There are 7 icons on the top of the back of this. I can hold it up here. That go through each of these items, right? So after I'm gone, you can give this presentation to anyone you like, right? The first one is about homelessness and the scale of the crisis and what's going on, and I know from reading your minutes you had some of that conversation through 3 months ago in July. The second one is a little bit about diversity among those experiencing homelessness. Who are the individuals that are experiencing homelessness? What are some of the demographics that make up the population, as best we know? The third is about the housing crisis. Who heard we have a housing crisis? I I heard about it. Although I didn't hear about it in the presidential primary debates. Housing crisis, but we want to talk about the housing crisis not in the same way that I feel like we hear about it in mainstream media a lot, but in a way that kind of distinguishes between how the housing crisis impacts certain populations and certain income levels versus others. So we want to dig in just a little bit on the housing crisis. The fourth point is evidence. I just told you that housing ends homelessness. We want to show a little bit of the facts around that. And then we're going to talk about cost. Cost is not a great argument when it comes to homelessness, but cost has been an argument that has driven our community's progress, at least from the governmental level. So we do want to address cost just a little bit. Then progress, right? It's easy for me to stand up here and say housing ends homelessness. It's easy for a county or an elected official to say housing ends homelessness. But what can we actually do about it? Are we able to build the housing that we need to end homelessness? So we want to talk about what's happened thus far, since we sort of agreed on this goal as a community. The seventh is about neighborhoods and some of the beautiful, wonderful things that you all were talking about. We want to talk about how these new housing developments can accentuate those things. How can these housing developments, how will these housing developments improve our neighborhoods and bring additional benefits and assets? The last one again, which I will say a lot of times, is action. What can you do personally? What can individuals do who want to get involved? So this map, I'm not going to spend too much time on it. I know that you all had this discussion again, as I said, in July, and I was glad to see that the community plan to end homelessness was included in that. That's this core agreement that was made between, I think, almost all of our cities and most other major stakeholders who are working on housing and homelessness in 2015. Oh, and just as an aside, that community plan is going to be entering into a new phase, right? It was a 5-year plan. Things change, approaches change, there are new ideas, and so there are going to be some community meetings coming up in the next, I think, 3 or 4 weeks, if you'd like to get involved at that level as well. And that's managed by the county, but we're partnering with them on that process. So this is 2 years old. We have new numbers. Who has heard of the point-in-time census? The point-in-time census is the only way we know how to count who is experiencing homelessness in our community. And it is a vastly imperfect process, but it's the only process that we have. And so how that works is, every 2 years in January, between about 5 o'clock in the morning and 9 or 10 o'clock in the morning, the county and the cities and nonprofit organizations and advocates come together and recruit volunteers. I was a volunteer this past January. In Gilroy I went. And those volunteers go out and walk every single street in the entire county, with the exception of maybe some super rural up in the hills, unincorporated, but literally every street, and with their eyes try to identify who is experiencing homelessness. This car looks like there's someone sleeping in it. This RV looks like it's been parked here for a long time. That person who's under a blanket seems to be without a home. And that's how we come up with these numbers, right? So you can see how that's not exactly the most accurate way. That's the federal government mandated way. But I put this up really not to focus in on any of the particular numbers. And again, since I haven't updated the numbers to the new year, the 2 years later, that shows you how important I think the individual numbers are. But it's to say that we have a regional problem. This is not a District 1 issue alone. This is not a downtown San Jose issue alone. This is not a District 7 issue alone or a Milpitas issue alone. This is all of ours together. And if we don't work on it together, then we're not going to make the progress that we need. We're not sure. We can have questions in between.
Well, I just want to clarify. So the numbers you're showing right there are actually 2 years old.
They are.
Okay.
Or now 2.5, right? Because it's just a count on 1 day. Or sorry, 2 days. 2 days.
Those numbers have probably gone up somewhat dramatically.
So what's the total number of homelessness in Santa Clara County today, according to the count in January of this year?
It was like 7,500, wasn't it?
I wish.
9,000.
9,700.
Right, it used to be 7,500.
The county, that's right, this is 7,300 something, was counted in January 2017. 9,700 was counted in January of 2019. Increase of 30-some% across the county, an even higher increase in San Jose specifically. Good question. We needed to get to the scale. So big number and increasing. We're going to get to the why increasing in a little bit.
Just a quick question.
Yes.
At the bottom there, it says percent per 1,000.
Yeah, this is sort of like my fault for bad presentation. I didn't know what kind of symbol to use, so I just moved the percent to the front and called it per thousand, but it's really confusing. So this number is 1.7 per 1,000 total residents. So census data, regular US Census data, 1.7 per 1,000 total residents in Gilroy. So it shows us a per capita number based on the 2017 count.
It should be 0.17%.
Yeah.
0.017%.
0.17.
Right?
So in other words, what that says is for every 1,000 people in Los Gatos, 1.7 of them are homeless.
Bingo. You got it. Yeah. And these per capita numbers shifted in the 2019 census as well, right? But you can imagine that if my city has super awesome volunteers, or my city has people who actually really know where they are and another city doesn't, who's going to have a better count, right? So you got to take these numbers with a grain of salt. So diversity, we're talking about more than 9,000. I think it's probably pretty safe to say. And when I first moved here, some of you heard this story before, again, I apologize. I didn't have this job, I had a different job. I lived in downtown San Jose on the south side of downtown, and I worked on the north side of downtown. And I would walk to and from work. So 15, 20 minutes, straight up First Street, 15, 20 minutes, straight down First Street. And I would see 10, 15 different folks who were experiencing homelessness. But I didn't see any families with children. I couldn't tell who had been a victim of domestic violence. I didn't know who was unjustly let go from their job. I didn't know who was a veteran. I didn't know where folks were from. Right? This is one that we hear less and less, so I think people are getting it slowly. But more than 80% of those who are experiencing homelessness in our county lived in a home here. Right? So I moved here from somewhere else. So somebody without a home can also move here from somewhere else, right? We don't have walls. But the vast majority were already our neighbors before they lost their home. Yes?
One thing I'd like to make a comment regarding the percentage of homeless that were prior residents here. I take that one little step further. Those within our own individual neighborhoods probably lived within our neighborhood before they became homeless, which is one of the reasons they are there now as homeless.
Have you experienced this in conversation?
I've experienced this in conversation with the homeless in my own neighborhood, and I myself was homeless for 5 months when I was wrongfully evicted from my home of 25 years.
Yeah. Thanks for sharing that.
So I know at least 20% personally of my homeless in my neighborhood. I knew them when they lived in the neighborhood.
Wow. Wow.
They are literally our neighbors.
Yeah. Yeah, I mean, the flip side of that is the other way to argue it, right, which is not the way that I approached it, first of all, is kind of like, who cares? We don't say to somebody who's new to the neighborhood and wants to put their kids in public school, like, no, you're not from here, you shouldn't use that resource. So I think you could make the same argument in this case as well. The other thing that I assumed, I moved here from somewhere else, and I'd never seen homelessness like this, to be frank. And I assumed that those 15 to 20 individuals I saw every morning and every afternoon had been homeless forever. That was just my assumption. I was working on something that had nothing to do with homelessness, but 41% of those who are experiencing homelessness are homeless for the very first time. And more than 60% have been experiencing homelessness for 1 year or less. 77% for 2 years or less. So, what does this mean? This means that yes, we do have a certain percentage of the population that is technically defined as chronically homeless. And chronically homeless means, by the federal definition, homeless for multiple years and on multiple occasions with some disabling condition is the language. So, you can look at this and see it's 20%, 30%, something like that. But the vast majority of those experiencing homelessness are experiencing homelessness for a relatively short period of time. and have not been homeless multiple times, right? This happened to them for the first time. So all of this is just to say, like, let's broaden our understanding of what the diversity of the population is, because it's probably not like the most visible group of people that you see in your neighborhood, or where you work, or where you like to go, right?
So a quick question.
Yes.
And this is probably a difficult question, but I'll ask it.
Difficult questions are sometimes the best ones.
Do you believe that the majority of homeless people don't want to be homeless?
Yes.
I can say without any doubt that the vast majority, meaning like 97%, do not want to be homeless.
Don't want to be homeless.
Yeah.
I've talked to other people who deal with homeless, and they've given a different answer.
Yeah, so we got to think about this in context, right? So let's say I'm a police officer, and I just finished an abatement. And then I'm talking to one of the people who I just made move all of their belongings, and I say to them, do you want to have a home? Now, A, there's no home for me to offer him, so it's kind of a false offering. And B, I've not presented myself as the most kind ambassador for that individual. No disrespect to police for doing their job, that's not my point. But in terms of the interaction that Bob, the person who's experiencing homelessness, had, that guy's not really my friend today. So how is my response going to be very affirmative? So I just think it's a little bit more nuanced, right? I mean, just think about, would you want to live outside in a tent for 6 months?
Some people might.
Yeah, no, it's and the self-reporting of this question, which also happens during the census, they do a survey of a sample of it, those numbers are 89, 90, 91%. Yes, of course we want a home. Right? But it's a good question. I appreciate you asking it. This next slide, yes?
To reinforce what Steve said, in a situation where I do talk with people who deal with homelessness, and there are a number of people who do not want to be confined and who do not want the restrictions and want to be left alone, this kind of a thing. So there is that segment. It's small, but there is a segment that do not want the controls or whatever it is, and they want to be free, or however they want to interpret, whether they're right mentally or what have you.
Right.
They do have a mindset that they want that.
So when I first moved here, I lived in an apartment building. And I had never really lived in apartment buildings before. I typically lived in homes or like a duplex. And that apartment building came with additional restrictions that I found really kind of annoying. So there were limits on sort of how many people I could come over. There were limits on what time I could be outside on my patio. There were limits to living in that apartment environment that restricted my freedom. And I think that applies to all kinds of people. The other issue that your question brings up is, or your statement brings up, is that we have to think about shelters or transitional or temporary differently from supportive housing or homes, right? Supportive housing is not a shelter. Supportive housing is an apartment building, what we're talking about, with individual apartments, with kitchens, with bathrooms, with bedrooms, or if it's a studio, that come with the same freedoms that I experienced in the apartment building I lived in when I first lived here. Shelters, on the other hand, or a navigation center they're now called and have a slightly different kind of orientation, do often come with much greater restrictions that some folks don't appreciate, right? So that is definitely a part of the conversation. So diversity. Now we move on to this slide I leave blank. It's really a kind of cheap way to get at some of the things that I have not yet incorporated that I should. So I apologize for our shortcomings, but the two things are important, and luckily we heard it already one time, but the first reason this is blank is for us to remember that we heard it 2 times already, to remember that we're talking about people, right? My entire presentation has 0 faces. There are no faces, there aren't even any names. But we're talking about folks that look like us, that are our neighbors, that could be a family member or somebody close to us. So just to help us remember that for 1 second. The other reason this is blank is about work that Destination Home is just now starting with lots of other partners, and that's race equity. So who knows what is the population of African Americans, total population, percentage in Santa Clara County?
Probably less than 2%.
Right, 2%, 3%, super low. What is the population of African Americans among those experiencing homelessness? 16. So if you're black in Santa Clara County, you are 8 times as likely to experience homelessness as your white counterpart. That is not okay. We have to figure out what is it about how we're either assessing and providing services within the homelessness system, but probably more importantly, which was alluded to in terms of jails being our new mental health institutions, what is it about our safety net system, so law enforcement, health care, foster care, what is it about those systems that allows people of color to disproportionately fall into homelessness and lose their home? And so we're starting a study to sort of look at first, what are the things we need to analyze? Where do we need to get data so we can look at it, so we can start to address this as a community? Housing crisis. Oh my gosh, the housing crisis. So we heard about some development that's coming in this neighborhood. There is development coming in many, many, many neighborhoods. Who has heard of the Association of Bay Area Governments? All right. Who has heard of the Regional Housing Need Allocation? Oh, less. Now we're getting real wonky. So I'm not going to get into too much of it, and it's not important to get super in the weeds. So the Regional Housing Need Allocation, often referred to as RHNA, are the goals that are set by this Association of Bay Area Governments for our cities and unincorporated county in the Bay Area. And they sort of look out at these 8-year cycles and they say, okay, job growth predicted to be, income levels are about here, we need X number of homes for each income group. So each column is an income group. These are 2 separate groups that they lump together for this purpose. And the 2 rows are the cycles of projections, right? And how well we did to meeting those, we as a community at large, meeting those projections. So in the previous cycle, we had a goal of 26,000 market rate homes, most cases apartments, new homes in our community. And we produced as a community 139% of the goal. Great, success. For extremely low income and very low income, this means roughly a family of 4 earning $65,000, $70,000 or less. We had a goal of 14,000 new homes, and we only produced 27%. Super unsuccessful. This is the new cycle. These numbers have been updated, I think, 1 year more later, but they're still as dismal. So not even, or a little over, no, not even halfway through, we have already produced 65% of our goal for market rate. And we have only produced 5% of the goal for the lowest income groups. Now, there are, of course, market reasons for that, right? We live in a capitalist society. Market rate development can project profits for the developer, for the bank that's investing money, and it's easier to get built, right? This housing, on the other hand, is more expensive because you have to finance it up to a level in case the subsidy goes away, right? So it's technically more expensive to build, and you can't project those profits, so you have to go get subsidy from multiple sources. In many cases in San Jose, almost all cases, it is city financing, investment long-term, it is county financing, it is hopefully sometimes also state grants and investment, it is private money from private banks and some of our corporate sponsors who are helping with that, and it is also federal money in the form of subsidy, or what's commonly referred to as a voucher, right? So super complicated, even just on paper, to put together. And if we don't prioritize it with those resources, then we see what happens. We don't get it. We don't get that housing. It doesn't happen by accident. And even some of the tools that we have developed as a community, like we have an inclusionary housing ordinance in San Jose, and there are inclusionary housing ordinances in other cities as well, in the county, not all. But those housing ordinances, if I'm a private developer and I want to build market rate, and so I have to build 15% affordable, or I have to pay a fee, right? That 15% of the total that's affordable never gets down to this level. Maybe a little bit of this very low income, but never gets down to extremely low income because they're super expensive to build. And so the developer says, I can't go to that depth of affordability because then it's going to make the whole thing impossible for me to finance. And so I just won't do it. Now, if they pay the fee, that goes into the city's affordable housing funds, and that can build this lowest income group. But all that is to say, we have some policy tools that we've created to address this disparity and lack, but the tools don't go to the lowest levels that we need really to prevent homelessness unless we dedicate it there, right? So, yes?
Do we use bonus density as a tool in this area?
I think so, yeah.
What was the question?
I wonder if we use bonus density, and is that not, that's not been, is that, have we been able to allow developers to build taller above what zoning would allow? That hasn't gotten us
So
additional affordable
yeah, we do, but that is a challenge because, you know, we try to go higher, but, you know, again, the community doesn't want to see us going higher. And again, that's part of the real conversation is, you know, really addressing it. You know, we have to understand that we have to build the housing in order to get the numbers we're trying to get to.
I come from Arlington, Virginia, and familiar with housing issues in the DC area, and that's their go-to tool. What we also found in Arlington is that, I mean, I am very much for mixed housing as much as possible, but what we found over and over again is that the developers time and time again preferred to pay money into an affordable housing pot so that they kept their buildings market rate, or maybe you get a few 68% AMI families in there, but the lower income were always built off-site somewhere else, and that wasn't integrating the way that it should be.
Yeah, so I mean, this is outside the scope of what Destination Home works on to a large degree, but this goal of kind of mixed income housing, which is a personal sort of value of mine, I think we want our neighborhoods to be diverse in that way, but the market doesn't provide it, right? And this is one example that even when a city, a government provides a tool, the market forces would prefer to just pay out than to play that by those rules. And also on the lower income side, so the housing that we're promoting, it also doesn't provide it because we have such a serious lack of housing at these lowest income levels. So we have an average, for example, the county housing bond. There's also restrictions from other funders as well. I think the city maybe has a restriction as well that doesn't allow it to go up to the highest levels because we're like, well, we're going to have 120 apartments here. We want to make sure that all of them are for the people who are at risk of becoming homeless. So let's focus down low. So all that is to say, if we want mixed income, we're going to need to look upstream and create some additional structural political policy changes in order to make that happen. It's not going to happen on its own. All right, but it's a good point.
And those are San Jose arena numbers?
This is a county.
Oh, that's county. Okay, thanks.
Countywide. Yeah, everything I say is countywide unless I say differently. So I have been talking about extremely low income and why we need it, but I kind of did it backwards. This needs some working to make it more clear, but this is getting to the point of why are we focusing on this extremely low income housing, right? Lots of people say affordable housing, affordable housing, affordable housing, but the needs of those who need affordable housing in the extremely low income bracket are dramatically more urgent and dire than all of the other brackets, right? And this is to help us sort of think about why that might be the case. In Santa Clara County, there are more than 65,000 families who are renters who pay more than half of their take-home pay in rent. Now, across the country, 50% of all renters pay more than 30%. So this is a problem a lot of people have. I too pay more than 30% of my rent, of my income in rent. Yes?
I work for the Census Bureau, and I happen to be working on the American Housing Survey, which is taking stock of the units in the country. I'm assuming that this is all based on 2017 data the last time the survey was conducted?
This is from the California Housing Partnership Corporation, from a fact sheet I pulled from them in late 2018. So probably yes.
Okay.
Yeah.
Because we're currently collecting this year's data.
Oh, I would imagine that it's worse. I mean, that's what the plus is, right? I would imagine that it's more than that now. So let's break that down, what that means, though. To pay more than half of your take-home pay in rent, if you're making $100,000, maybe is not so dire, right? Okay, a few less vacations. Okay, maybe I go to a different grocery store for some of the stuff that can be cheaper, but I'm probably not going to lose my home because of it. But if your income is $40,000 or less for your family of 4, that means that your rent, that means you're taking home $2,600 or less every month. Can you get a market rate apartment for $2,600? No, you cannot. Not for a family of 4, definitely. And your rent is at least $1,300. But let's say I'm not making 40 grand, I'm making 30 grand. So my take home is about $2,000. And my rent isn't $1,400, it's $1,600, or it's $1,700, or it's $1,800. So now I have $200 left for my family of 4 to cover the hospital bill when I break my leg because I'm a contract worker and I don't have insurance, to pay for gas to go anywhere, to pay for public transportation even to go anywhere for a family of 4. I met a gentleman 3 weeks ago. I don't know how old he is, but probably 80, give or take, 5 years. Lives in affordable housing. Not supportive housing that we're talking about here, but lives in affordable housing and is on a fixed income, Social Security. His rent in affordable housing is now 81% of his take-home pay. And at this income level, this leaves him with $113 every month. And he is desperate. He doesn't speak English very well, and he wrote it down for me on a napkin, and then later he wrote it down for me on a piece of paper, and is trying to figure out how he's going to fix this. And how we fix this is more housing that's affordable for folks with the lowest income. And we don't get it if we don't prioritize it. The city passed earlier this year an increase in, so all of our affordable housing dollars, 45% of them are going to go for extremely low income housing. Great step in the right direction. We got to do more. We have to focus on lowest income housing because, right, we need to prevent homelessness. So I told you those numbers, 7,400, now 9,700. Why is homelessness increasing if we're doing so much work on this housing? All right, I'm doing such a great job. You heard Nami that told me Destination Home doing such a great job, but yet homelessness is up 30%. Why? Not increasing supply fast enough, for sure.
Well, I think part of the problem is that, and I don't mean to criticize, but I think of the city allowing a developer to buy out from, including these homes in their projects. Yeah, it's great that money goes into a fund that's supposed to go to housing, but where is the city? The city's having problems finding the land and locations to build this stuff on because so many of the neighbors don't want this stuff there, and they're having problems being able to build this stuff. So that money's just sitting there doing absolutely no good whatsoever.
Complicated issue, but certainly valid points on both sides, right? I like the money going into the fund, ultimately, because it gets me the housing that I think is most important. But you're right, it's slower. We're going to need more land. Right? It's got to be somewhere else. We need another developer. We're going to need other financing from, like there are other complications. So there's certainly arguments on both sides. Now's the part before we get into some more good news, now's the part for the really bad news. Right? Every single month in Santa Clara County, all the nonprofits who are doing direct service, all these nonprofit housing developers who are building, we move 100, sometimes 80, sometimes 110, 100 folks from homelessness into supportive housing. Great, every single month. It's been consistent for about 3 years. It goes up and down a little bit. All this data is public. The county reports it quarterly to the Housing, Land Use, Environment, and Transportation Committee. But in that same month, 3 times or 4 times are losing their homes in our community. So are showing up at the county system through one of these nonprofits, one of these doors, saying, I got a divorce, I got evicted, I'm sleeping in my car, I need housing assistance. So we're taking 2 steps forward, and we're taking 5 steps back every single month. That is also why we need extremely low-income housing. Because if somebody loses their apartment today because they lost their job, and they can sleep with their cousin for a month, then they need a place that they can afford. But if they were in a place where the rent was, if they were lucky, $2,000, when they go back out on the market, they're going to find something that's $2,400, right? And they're going to be even more at risk the next time something happens. So it's all to make this case for why we need this lowest income. We had one question over here. No? Yeah?
Got a question, but
Fine.
just to comment, in our neighborhood, what we see is that houses that had been rentals are being slowly sold, and they're becoming ownership houses, which is,
Yeah.
and we're also seeing, garden-style apartments that are being renovated, and then the tenants are off, they can come back if they're gonna pay a lot more in rent.
Yeah.
But just kind of like, we have a neighbor nearby who had been renting a house for a long, long time. Owner is selling the house, and this person has been in the neighborhood such a long time and has so many friends, and another neighbor has decided to build a room on the back of their house and for this woman to live in, because she
Awesome.
doesn't leave the neighborhood.
Yeah, super awesome. I mean, I think that the ADU stuff that the mayor and others have been pushing, like, can address this a little bit. I wouldn't want to, like, put it up on too high a pedestal as being the solution, but there is this sort of idea of a model anyway, where an older couple or individual lives in a large single-family home, or just a 2-bedroom single-family home. Couldn't we build a smaller cottage in the back so that that family can rent out the front to supplement the income, and then they also have a place to live? But that is going to need some, like, intervention to make it happen, right? Somebody's going to need to both drive that and lay down some capital to make it happen to begin with. Yes? I'm sorry, I'll come back here.
Okay, in Minneapolis, they have actually done that. And they have rezoned all single-family housing to three families
Yeah.
in a house. And 90% of that is people renting out home, renting out parts of their home.
And they just did it in the downtown core in Durham, North Carolina a couple of weeks ago too, right? Sort of picking up. Yes?
So I was going to say there's a senior housing in Santa Clara, Camino del Rey, where everybody's low income seniors, and so most of them are just on, Social Security. They might have some work. And the rents have gone up from 2016 at $1,100 to $1,600. So the people who are on just Social Security are, couples are being told, like, you might have to get a job so you can stay here. So, that's happening right in Santa Clara.
Yeah.
So just real quick, in the interest of time, is it okay if we go over to like maybe 10 minutes after 11? I mean, normally our shut off is 2 minutes. Sounds good. Okay, so. Yes.
Then let me speed through.
Yeah.
We're almost there.
Okay.
So what is supportive housing? I already kind of tipped it off. Just apartment buildings. Totally normal apartment buildings, but there's services on site. And the services are the obvious things that you think of, right? Mental health, physical health, addiction recovery, but it's also helping folks who are able to find employment, figure out what kind of work, part-time, full-time, that they can get back engaged in the community with. It's also just community interaction, right? Where is the potluck so I can go get to know my neighbors? What's going on at the park in this walk that I didn't even know existed down by the Redwoods, right? How do I engage with the church in my community or the neighborhood association in my community? Folks need stuff to do, particularly if because of a disability they're unable to work. Another one that was also mentioned already is family reunification. All right, if I lost my job on Monday because I gave a horrible presentation in District 1, then I could probably stay in my current home for a couple months, right? I've been okay lately, I've got like a little bit of pad, but after that, I'd have to move out. Like, rents are just too high. I can't stay there without a job. It'd probably take me 4 or 5 months to find a job. So I'd go live with my cousin in Berkeley. They've got an office that can be a bedroom. Great, I'd be okay for the short term. But if I had burned my bridges with my cousin in Berkeley, and I had just moved here a year ago, and I didn't have any friends really, I wouldn't have anywhere to go either. I'd either be in my car sleeping in it, or I'd be in my car hightailing it to somewhere where I do have family if I hadn't burned all those bridges, or if they hadn't burned the bridge with me, right? So family reunification is a real thing that's part of the services that are provided. Meaningful daily activities. So how successful is supportive housing? I told you it was way more successful than the other approach, the housing ready approach. But how successful do we think it is? What percent? What percent of those who move from homelessness into supportive housing are still stably housed a year later? 70?
95%.
90, 95? I mean, I kind of gave it away, I guess. 90%. I think currently in Santa Clara County is 91%. And it's not because we're so awesome. It is successful everywhere. 85%, 95%, 90% supportive housing works. Now that doesn't mean it's easy, right? It requires really good service provision from really well-qualified nonprofit service providers, and that includes a plethora of organizations that are helping with it. It requires very well-produced and maintained buildings, right? All of these are requirements, just like they would be for the apartment that you would want to live in downtown, right? But 90% successful. Now cost, very briefly. This is taken from a study from the pilot that we did at the beginning when we first started working on this in 2015. The first 1,000 folks that we moved from homelessness into housing, the 0 point is when each of those 1,000 individuals moved into supportive housing. Each of the bars is made up of little dots that represent a use of a county public service. So as you can see, you give increased data collection up toward the day that someone moves into housing, and as soon as they move into housing, what happens? Crazy drops off. So let's say Bob has a serious physical disability, and I move into supportive housing. Is my physical disability cured? No, it is not. But am I less likely to have an accident in public where I require an ambulance and the emergency room? Yes, I am less likely to have that happen to me. I have folks in the building with me who are watching out for me. I have neighbors in the building who are watching out for me. So supportive housing dramatically reduces the cost of public services. We did a study of those costs at the county level in 2014-15, and at that time, the county was spending $520 million a year managing homelessness. So no housing here, just what it says. Healthcare, justice system, social services. And this is not an argument to say that these things are not important. In fact, I would probably argue that we need to increase a lot of that. But as long as we allow people to remain on the streets without providing housing and the help that folks need, this just goes through the roof. Luckily, this study led the Board of Supervisors to an even higher number, and that's $1 billion. 950 million. The 2016 Measure A Affordable Housing Bond has allowed us to move forward rapidly with production of supportive housing. Before 2015, in the entire county, we had fewer than 400 homes with supportive services. Today, we have more than 3,000 in the pipeline. These don't add up to 3,000, but they're new ones since then. So that's progress. That's saying we set a goal in 2015 of 6,000 new supportive housing opportunities, and now, 4 years later, we're halfway there. We're not going to meet the 2020 goal of 6,000. We're going to be short. But it does mean that when the community comes together, when you add the private subsidy and get government to act in the way that they need to make this happen, we can push this forward. This is a map of where all the supportive housing is in the county. That includes new development and also where services have been added onto existing housing. Currently, there is supportive housing in 10 of our cities and more than 50 apartment buildings. So it's not everywhere, but it's throughout the county, and that's the way that it should be. This blue box is just the county housing bond. I said $1 billion. They've already got 234, I think a little bit more now, out the door. Those developments are going to create more than 1,400 new homes in 6 cities. This map is interactive, is on the website, so you can click and see what it is, where it is, who it is, how big it is, little picture of it. 1 second. Then just to show you what it looks like. This is Villas on the Park that's coming downtown. This is 100% permanent supportive housing, so all folks who have high service needs, formerly experiencing homelessness. 84. This is opening, I think, probably at the beginning of next year. This is one in Milpitas. That's a different model. It's 1/3 permanent supportive housing for folks formerly experiencing homelessness. And then 2/3, these lowest income groups, extremely low income affordable housing, so we can prevent homelessness. There's another one in San Jose that's a different model. It's kind of 50-50. Half of it is planned to be temporary assistance, so folks who are experiencing homelessness who need help for a temporary period of time, so not chronically homeless, not high service need, and then 50% lowest income affordable. And that's it. This is the website if you want more information. I'm really proud to be working with the Vice Mayor's office and his team to move the homelessness roundtable forward and support however we can. So I think they have a sign-up sheet for that if you want to get specifically involved at the door. This is just a little bit more information. All of this is available on our website publicly, so you can access it anytime. Housingready.org is just a shortcut that goes to a page on the Destination Home website. My card is also here. I'll put it at the back. If you ever have specific questions, something that was not addressed here that you want to learn more about, I'm here to be a resource. So I might not know it, but I probably know how to figure it out, right? And thank you all for listening.